We're seeing many more of those patients under 5 that seem to be affected by the variant as opposed to other variants in the past.
The Omicron variant is taking a toll on children, increasing the number of pediatric patients in South Florida's children's hospitals. The chief medical officer at Nicholas Children's Hospital says doctors are seeing more young kids and children with special needs. CBS 4's Peter Dench spoke with the doctor and has more from the hospital. Peter?
This Children's Hospital says the number of pediatric patients with COVID-19 this month could surpass what was a peak this past summer. Big concern is the number of younger unvaccinated patients.
Here inside the Nicholas Children's Hospital, doctors and nurses have been doing everything they can to protect their pediatric patients.
We're seeing many more of those patients under 5 that seem to be affected by the variant as opposed to other variants in the past.
Dr. Marcos Mestre, the chief medical officer for Nicholas Children's Hospital, says there are 2 key factors.
It's a combination of factors. 1, they're not vaccinated, and 2, this Omicron variant tends to concentrate in the upper airways, which tends to affect younger children.
Here at the hospital, the number of pediatric patients in January with COVID could surpass a summer peak of 150.
This seems to be focusing on our younger population and also seems to be affecting our population of special needs children with medical complexities that tend to be having more difficulty with this variant as opposed to others.
Statewide COVID-19 patients are using 19.48% of all ICU beds, according to the Department of Health and Human Services. Coping with COVID remains a challenge here at Nicholas Children's Hospital and everywhere.
Number 1, from a fatigue standpoint, I've been dealing with this for a couple of years. That's hard enough as is, but also from a staffing standpoint, we do have a lot of our staff members that have been out with a COVID infection, and therefore we've had to have others step in when they may have been on vacation or whatnot to take on some more shifts. So that's been difficult.
Dr. Mestre says the end may be in sight.
Thankfully, we think we're at the peak, we're slowly past it, and we're seeing more staff coming back. So that's a good thing. And we're seeing our slight decrease in numbers in our emergency departments and our urgent care centers, which hopefully is an indication that we're declining.
Dr. Mestre said there could be a significant decline in cases by early February. Some medical experts are seeing a peak in cases by mid-January, which of course is next week. Coming up at 6, we'll take a look at one Broward hospital and how COVID is taking its toll on the number of employees there calling in sick, where 7% of its workforce last week called in sick. We're live at Nicholas Children's Hospital. Peter Dench, CBS 4 News.
Peter, thank you.